Hello, I'm Dr. Mary Massey Story, Assistant Professor of Family Medicine and Clinical Assistant Professor of Family and Community Medicine at Northeast Ohio Medical University's College of Medicine. Welcome to Take Charge of Your Health. These videos are for educational purposes only. They're not to be used for treatment or diagnosis of any medical condition. Please see your primary care provider for treatment and diagnoses of any medical condition. I would like to talk about hypertension. In order to talk about hypertension, I have to first talk about blood pressure and what it is. So blood pressure is the pressure that's created when the heart beats and pushes blood through blood vessels. It's given in two numbers. The first number is the systolic blood pressure. That's the force that's created when the blood pumps from the heart and circulates through the body. The second number is called the diastolic blood pressure, and that's the force that's created when the heart is resting between heartbeats. Again, blood pressure has two numbers. So a blood pressure of 130/80 translates to a systolic blood pressure of 130 and a diastolic blood pressure of 80. So what is hypertension? Hypertension is when the force of blood pushing on blood vessel walls is consistently too high. The force causes the heart to pump harder, and the arteries that carry the blood away from the heart need to work harder. This table shows normal adult blood pressures. The first green line across is ideal. That's a systolic blood pressure less than 120 and a diastolic reading less than 80. Normal blood pressure is a systolic blood pressure less than 130 and the second number, the bottom number, less than 85. High normal is a systolic blood pressure that ranges between 130 and 139 and a diastolic blood pressure that ranges between 85 to 89. There are some conditions that can increase the risk of developing high blood pressure, and this lists a few, but it's not an exhaustive list. Heart disease, diabetes, chronic kidney disease, obesity, high cholesterol, smoking, diet high in salt, alcohol, lack of exercise, and stress. This table shows the high adult blood pressure readings, also known as hypertension. There are different stages or categories of hypertension. Stage 1, Stage 2, and Stage 3, as you see. So Stage 1 is a systolic blood pressure reading between 140 and 159, with a diastolic blood pressure reading between 90 and 99. Stage 2, systolic blood pressure readings range from 130 to 179, and diastolic readings range from 100 to 109. Stage 3 hypertension is a systolic reading of greater than 180 and a diastolic pressure reading that's greater than 110. When we talk to patients about their blood pressure, hypertension, we want to ask about medical history. This is really important to help patients to know how to best manage their blood pressure and the things that may be contributing to them having blood pressure. So we want to know how long you've had high blood pressure, and if you happen to know what your numbers have been and how many years it's been elevated, and whether it's ever been controlled with medications or diet. We want to know the type of diet you have. Is it high in salt, high in cholesterol, high in saturated fats? That's important. We'll talk about weight. If weight's been a struggle, we want to know how long and what you've done to try to lose weight, because there are times that we can help with referrals to nutritionists and weight loss specialists. We want to know what kind of medications you're taking. Medications, believe it or not, whether they're herbal, over-the-counter, or prescribed, can sometimes contribute to high readings of blood pressure. Smoking, how long have you been smoking? How much do you smoke? Same thing with drinking. How often do you drink? How much do you drink? And what do you drink? We also want to know about diabetes. If you have diabetes, how long and is it controlled? Sleep apnea. If you have sleep apnea, what's been done for it? Do you treat it? Or if a patient has symptoms or appears to have symptoms just based on the history that I get, sometimes I'll refer to see if they have sleep apnea because we know that contributes to high blood pressure readings and heart disease. We also want to know if there's any kind of chronic kidney disease in yourself, and also exercise. How much, how often. Along with all this, we want to know about family history, because we do know that if there's a family history of high blood pressure, that increases your chance of having high blood pressure. And we also want to know if there's any family history of the conditions we just asked about: diabetes, heart disease, sleep apnea, stroke. Those are all important. When we do physical exams, we do a general exam, but we also do focused exams. And the reason for the focused exam is because these particular organs have very small blood vessels that are associated with them. And so, as I mentioned, with high blood pressure, kind of putting a lot of pressure on vessels, this is how it can manifest when those vessels are taking blood flow to certain organs. So with the heart, for example, is the organ. If someone has a strain in their heart from high blood pressure, they can have heart failure eventually. They can also have an enlarged heart. And they can have vessel damage rather, that supply the heart. So the coronary arteries that supply the heart can be damaged. Heart failure and enlarged heart muscles mean that the heart is not working efficiently. It is not getting blood around efficiently, and our blood carries oxygen to those vital organs. So eyes can be affected. Again, if the blood vessels that supply the eyes are not able to do their job well, then people can develop blindness, or at least decreased vision that can later lead to blindness. The brain, another organ that is affected by high blood pressure. You may hear people having mini strokes, or also called TIAs, which are transient ischemic attacks. They may have big strokes. So it's really important to control blood pressure because of the effects it can have on the brain and on memory. Kidneys can be affected. Kidneys can become less effective or less efficient at working, and people can develop kidney failure and sometimes need dialysis to help clear the different toxins in our body through. Peripheral blood vessels can be affected, and those are vessels that lead away from the heart to our extremities. So for example, our legs have blood vessels that can be affected by high blood pressure. And sometimes people will develop pain with walking. So we also check, the pulse in the feet and see if there are any vessels that are swollen in the legs. Those can all be affected by high blood pressure. We do screening tests based on a history of the patient and a family history. So we may want to check your kidney function, and that's done by a blood test. We may want to know your sugar level, see if you're diabetic. And if you are diabetic, see how well it's being controlled. We'll want to know your cholesterol and triglyceride levels. We may get urine and see if there's protein or blood in the urine, which sometimes will let us know if the kidneys are under extreme pressure. And sometimes EKGs or ECGs are done, and that lets us know the heart and how well it's working and the electrical impulses that it creates. If there's blood flow issues to the heart, those electrical impulses are not transmitted well, and we can see that on the reading. And sometimes we'll do a chest x-ray. If someone has an enlarged heart or heart failure, we'll oftentimes see the changes on chest x-ray. This is a busy slide, but if you can focus on just the columns, the vertical columns, that'll help us to kind of go through it. Ways to manage and treat high blood pressure. Lifestyle changes are always key. Making healthy food choices, maintaining a healthy weight, stop smoking, regular exercise with your doctor's consent as far as the type of exercise you should do. Decrease salt in your diet, reduce stress, relaxation techniques, decrease alcohol. So those are things that we can control. Your primary care provider is important. Make and keep appointments with your provider. We would monitor your blood pressure. We can adjust medication, and we can give words of motivation and affirmation. Our goal is to one day possibly be able to decrease the amount of medicine you're on or stop medications altogether, but it takes true teamwork. The only way to make that happen is by, again, incorporating some of these lifestyle changes along with medications to see if one day that we can get you off of medications. And again, medications can be important and can be used. There are different classes of medications. This lists several of the main classes. The first one is ACE inhibitors, which stand for angiotensin converting enzyme inhibitors. The second are alpha blockers. Third are alpha agonists. Next is ARBs. We call them angiotensin receptor blockers. There are beta blockers, calcium channel blockers, and diuretics, which we also call water pills. Each of these medications work differently, and I won't go into details with all of those, but there is a slide that references you to a link that can talk more in detail about how they work differently and how they can work together if necessary to control blood pressure. And lastly, there are specialists that we refer to. So if we need further assistance with medication management or additional tests, we may refer you to a cardiologist or to a renal doctor, endocrinologist, or a pulmonologist. And again, nutritional services are oftentimes needed as well. It takes teamwork to treat hypertension. Learn all that you can learn about blood pressure. Know your actual numbers. Know the names of your medications and the dosages. I oftentimes will see patients who come from outside of my hospital system and they're coming in for a blood pressure check and medication adjustment, but they don't know what they're taking already. They don't know the strength. Sometimes these medications can have long names, and sometimes the numbers get kind of confusing. So if that's the case, write the numbers down, the names down. So I say numbers, the dosages, and keep them with you in your wallet or in your purse. So if you do go outside your system of care, someone knows what you're taking and can know what to safely give you while you're taking that medication. Monitor your blood pressure at home or go to a pharmacy. Again, it's important to know your numbers. And that way, if a medication is given to you in clinic, you can monitor yourself to see if it's working and give that feedback to your provider. Don't be afraid to ask questions about the treatment plan. So if you want to know how well things are working, or let's say you have a side effect that's being caused, you can talk to your doctor or a nurse practitioner or a physician assistant about that. Contact them if you're having side effects. It's really important because there are other medicines that can be given. There are things that can be substituted, and just run it by them so they can see how best to treat that situation. And again, lifestyle changes are important. You can control the lifestyle changes. That part you have control over. Here are a couple links that talk about medications and their side effects. You may see some of your medicines listed there, so that's very helpful, so please see those. Some works cited. And I really hope this was helpful. Thank you for your time and take care of yourself.